that were developed for rheumatoid arthritis, currently in trials for severe COVID infections. Cytokine storm is actually taken from this bigger concept of this sort of hyperinflammatory state that can happen either in the setting of infection or sometimes does happen in rheumatic diseases. So it is correct that in some severe cases of autoimmune or rheumatic diseases, you can have a cytokine storm. In lupus, we haven't used that word so much because it's rare that you get such a robust storm all at one time, although I think the closest that you have is some of the patients with severe nephritis could resemble this. And then there are some conditions that really have a very similar version of cytokine storm that are called autoinflammatory conditions, frequently affect children. And these conditions, you see this sort of overwhelming cytokine response. But the general principle, I think there are a lot of parallels between lupus and other autoimmune conditions and the over responsive system and what happens in severe COVID, where it's actually beneficial to bring it down. For some people, it may sound a little strange that you have an infection and you want to use something to bring down the immune system. And it's not necessarily for all COVID, but when it gets to that point that there's a cytokine storm, it's actually important to interrupt that to help the person survive.
So I guess I have a little follow-up to that, Doc, and maybe you touched on it, but so you did address, we were wondering how other people with rheumatic or autoimmune diseases react to COVID, and I think inflammation is a common factor, if I understand that correctly. But in the cases where a cytokine storm can happen, like in lupus nephritis patients, as you mentioned, if they were to get COVID, would everything with the inflammatory process be exacerbated that much more?
It's a good question, and I'll say that we only really know this from anecdotes now. Thankfully, we haven't seen that combination very often, um, but it would be an example of the virus hitting a person at a very vulnerable time when you're already very ill, and most likely that would be a very dangerous combination. If you're already having cytokine storm, then you would likely be trying to treat that to begin with, and the COVID would definitely not help. Yeah, luckily for most of the time, people living with autoimmune conditions, you're